Hey, y'all, welcome back to What the Health. I'm Dr. Sarah Baxley, a board-certified primary care and mental health provider. And today we're talking about something that so many people have experienced, but often struggle to name: medical gaslighting. Now, let's be real. Everyone and their mama has heard the term gaslighting by now. It's basically when someone manipulates you into questioning your own reality. Like, you know what happened, you know how you feel, but usually someone with a little more power in the situation, is making you doubt yourself. You hear about gaslighting a lot in relationships. Like, say you catch your partner in a lie, and instead of owning up to it, they go, "Wow, you're so sensitive. You always overreact. I never said that." And suddenly you're sitting there thinking, wait, am I crazy? And chances are you're not. Now, let's take this same concept and drop it into a doctor's office. That's medical gaslighting. And let me tell you, it happens so much more than I'd like to admit. I've lost count of how many times patients have come to me frustrated because they have been dismissed over and over again. I've had patients say things like, "I kept telling my doctor I was exhausted all the time. I couldn't get out of bed exhausted." And they just said, "Well, you're a mom of two. Of course you're tired." But something felt off, you know? Turns out my thyroid was completely out of whack. Or that patient that came to me and said, "I was having chest pain, real pain, not just anxiety." And the ER doctor literally said, "You're young. It's probably just stress." They didn't even run tests. A week later, I went and saw another doctor, and guess what? I have an actual heart condition. And then another one of my favorite is, I told my doctor I was in pain every single day, and they said, "Well, your labs look fine, so there's nothing wrong." I wanted to scream. Just because my blood work is normal doesn't mean I'm making this up. Do any of those sound familiar? If you've ever walked out of a doctor's office feeling like you weren't heard, like you were crazy for even thinking something was wrong, then yeah, you've probably been medically gaslit. And the worst part, it's not just frustrating. It can be downright dangerous. People's lives are at risk when doctors don't listen. So today, we're breaking it all down. What medical gaslighting looks like, why it happens, who it affects the most, and most importantly, how to advocate for yourself when a doctor isn't taking you seriously. All right, so let's get into it. So now that we've set the stage, let's really dig into what medical gaslighting is, because it's not just a patient being dramatic or wanting attention, despite what some doctors might make you feel like. Medical gaslighting happens when a doctor or healthcare provider dismisses, minimizes, or outright ignores a patient's symptoms, often making the patient feel like they're overreacting, imagining things, or just being difficult. And let me tell you, this is not just about having a bad doctor. It is so much deeper than that. How does this happen anyway? Well, there are a few ways that this shows up. And if any of these sound familiar, just know you're not alone. The "it's just stress" brush off. This is a big one, especially for women. I've lost count of how many patients have told me they went to their doctor with chest pain, dizziness, stomach issues, fatigue, and were told, "It's just stress. You should relax more." Well, first of all, listen, buddy, if that was an option, don't you think I would be entertaining it? Now, listen, stress can cause physical symptoms, but stress is also the easiest cop-out in medicine. I once had a patient who was told for years that her chest pain was just anxiety. When she finally got a proper workup, she had a serious, life-threatening heart condition. It's so frustrating to see that happen. The next one is, you've all heard it, that "your labs are fine, so you're fine" dismissal. This one makes me want to throw a fucking chair. Just because blood work is within normal limits, and I'm using quotations, you can't see me, does not mean you're fine. Patients with conditions like autoimmune diseases, chronic pain disorders like fibromyalgia, or hormone imbalances know this all too well. A lot of these illnesses don't show up in basic lab work, and yet patients are consistently told, there's nothing wrong with you. I had a patient with severe fatigue, hair loss, weight gain, classic thyroid symptoms, right? Her doctor ran one single test, a TSH, a thyroid stimulating hormone, very standard procedure. It came back normal, and that was that. No other test ran, no further evaluation, just it's not your thyroid. Turns out she had Hashimoto's disease and needed a full thyroid panel to catch it. The next one is, and you guys are going to love it because I know you've heard it. You just need to lose weight, default. I cannot tell you how many times I've heard patients say, I went to the doctor for XYZ and they told me to lose weight. Back pain, lose weight. Joint pain, lose weight. Hormonal issues, lose weight. I had a patient with extreme pelvic pain not that long ago, and her doctor kept saying, well, if you just lose weight, it would probably improve. Well, if you would just learn some manners, your attitude would probably improve. But we don't say that. Guess what? That patient had ovarian cyst. Losing weight wouldn't have done a damn thing. Oh, another good one, especially for the younger generation. You're too young for that excuse. Listen, just because something is less common in younger people doesn't mean it doesn't happen. There are young women who have heart attacks, young men who develop autoimmune diseases, and teenagers who struggle with severe chronic illnesses. One of my patients was 23 years old and had unbearable joint pain. Her doctor laughed and said, you're way too young for arthritis. Guess what? She had rheumatoid arthritis, one of the most painful arthritises on the planet. And let's talk about now, who gets gaslit the most? If you had to guess, who would you say? Now, here's where things get really frustrating. Not everyone experiences mental gaslighting at the same level. Some groups get dismissed way more than others. So when you guessed earlier, if you said women, especially women with pain-related conditions, you are right on the money. Conditions like endometriosis, fibromyalgia, and autoimmune disorders are all way more common in women, yet women are consistently told, it's just your period. Oh my God. Or you're overreacting. You're so sensitive. Listen, nothing makes a woman want to see red more. Next up, for all my minority friends out there, Black and brown patients are more likely to be the victims of medical gaslighting. There are actual studies showing that Black patients, especially Black women, are less likely to be prescribed pain medication because doctors assume they have a higher pain tolerance. What ignorant bullshit is that? They're not just gaslighting, that's medical racism, guys. And then we've got our neurodivergent patients, like our patients with ADHD and autism. If you're autistic or have ADHD, you've probably been told before that you're just being dramatic or you're too sensitive. Doctors often assume autistic patients are over-exaggerating their pain or don't take their symptoms seriously because they communicate differently. And then this is going to lump a ton of y'all in together. We've got anyone with a mental health diagnosis. You have anxiety, depression, PTSD? Prepare to have every symptom blamed on that. Oh, you're dizzy? It's probably just your anxiety. Oh, you're nauseous every day? Maybe it's depression. No, maybe I actually have a medical condition. So yeah, medical gaslighting is a huge problem, guys. It's not just about being dismissed. It's about real medical conditions being ignored and patients suffering for years because no one's taken them seriously. Up next, we're going to talk about what happens when medical gaslighting goes unchecked, the real consequences of doctors brushing off patients, and let me tell you, it is not pretty. Okay, so we've talked about what medical gaslighting is and who it affects the most. But let's get into the real-world consequences, because this isn't just about hurt feelings or leaving a doctor's office annoyed. This is about people getting sicker, being misdiagnosed, or even dying because their concerns weren't taken seriously. And I wish I were being dramatic, but I am not. Delayed diagnoses equal worse outcomes. Medical gaslighting delays diagnosis, sometimes for years. And by the time patients finally get the right care, their condition is way worse than it needed to be. Take heart attacks in women, for example. Women often don't have the classic crushing chest pain like most men do. Instead, they might feel nausea, back pain, fatigue, or a little short of breath. And what happens when a woman goes to the ER with those symptoms? That's right. It's just anxiety. Or, I'm going to go out on a limb. Maybe it's acid reflux. You're too young for heart problems. By the time someone actually listens, she might already be having a full-blown cardiac event. Or think about endometriosis, one of the most painful conditions a person can have. And yet the average time it takes to get a diagnosis, fucking 8 to 10 years. You heard me correctly, years. Because doctor keeps saying, oh, painful periods are normal. Trust me, they're not that normal. When doctors dismiss symptoms or make snap judgments, they often misdiagnose people. And that can mean getting treated for the wrong thing, which can be just as dangerous as not being treated at all. I had a patient who had MS, multiple sclerosis. But for 2 years, her doctors told her it was just stress. Her numbness and balance issues, oh, that's anxiety. By the time she was actually diagnosed, she had permanent nerve damage. Another patient kept saying, I feel like my heart is racing out of nowhere and I get really shaky and sweaty. Her doctor? Sounds like anxiety. Here's some Lexapro. But guess what? She had a thyroid disorder, and that anxiety was actually her body screaming for help. And let's not forget people who go in with persistent pain, only to be given ibuprofen and a you'll be fine pep talk. Slap you on the ass on the way out. When they actually have cancer or a serious autoimmune disorder that's being completely overlooked. The psychological toll when you start doubting yourself, guys, this one is huge. After being dismissed over and over, a lot of patients start wondering, am I actually just overreacting? Maybe I am just being dramatic. Maybe this is just in my head. And that's so dangerous because it makes people stop seeking care. I've had patients tell me, I gave up going to the doctor because they never listened anyway. Do you know how heartbreaking that is to hear? Others say, I don't even trust myself anymore. What if I'm just imagining it? Let me be crystal clear. Hear me right now, guys. You are not imagining it. Your symptoms are real. Your pain is real. Your body is trying to tell you something, and you deserve to be heard. The worst case scenario when medical gaslighting turns deadly. I wish I didn't have to say this, but sometimes medical gaslighting literally kills people. There are countless stories of people, especially women, Black patients, and young adults who were sent home with nothing's wrong diagnoses and then died of preventable conditions because no one took them seriously. I read about a 26-year-old Black woman who went to the ER with chest pain. They told her it was anxiety and sent her on home. She died of a heart attack that very night. There was a young woman who begged her doctors for a full workup for her stomach pain. They brushed it off, told her to manage her stress. She had stage 4 cancer by the time anybody actually ran tests. Y'all, this is not rare, and it's not just bad luck. It's a systemic problem. When doctors don't listen, people suffer. When they assume symptoms are all in your head, people get misdiagnosed. When they brush you off instead of investigating, people die. So what can we do? How can we stop this from happening? In this next section, we're going to break it all down. Why medical gaslighting happens and how you can advocate for yourself in the doctor's office. All right. So we know what medical gaslighting is. We know how much harm it causes. But the big question is, why does this keep happening? Why are so many doctors missing the mark when it comes to listening to their patients? I wish there was a simple answer, but the truth is, it's a mix of bias, flawed medical training, and a broken healthcare system. Let's break it down. So, cognitive bias, when doctors think that they already know the answer. Doctors, just like everyone else, have mental shortcuts they use to make decisions fast. Sometimes those shortcuts are helpful, like in the middle of a crisis, knowing what to do. Other times, they lead to wrong assumptions that hurt patients. And here are a few of the big ones. Something called anchoring bias. This is when a doctor locks onto one idea and ignores everything else. So let's say you come in and you're complaining of painful urination. Your doctor immediately says it's a UTI. It's a UTI, it's a UTI, it's a UTI. No matter if you say, this doesn't even feel like it normally does. This is it. Doctor locks onto it, and that's what they're going with. Like if you're a young woman with chest pain, they assume, oh, it's anxiety, and never even consider running tests for a heart condition because you're too young. It wouldn't happen with you. Same thing. Confirmation bias. This is a big one. This is when doctors look for evidence to confirm what they already believe instead of keeping an open mind. So think about in criminal cases where detectives or police officers are under huge pressure to find a suspect, to find the person who did this. And so they find somebody who fits the bill and then craft the evidence to fit the crime. Same thing in medicine. So doctors already looked at you, decided that you're just stress, and they'll only hear the symptoms you tell them that support that it's just stress and ignore the ones that don't. Implicit bias is another one, and this is a big one too, because whether they realize it or not, doctors have biases about who they take seriously. Women, too emotional. Black patients, tougher, so they don't need pain meds. Fat patients, everything is because of their weight. Mental health patients, they're probably lying or making it up. And all of this affects how doctors treat people. Next is the one-size-fits-all approach to medicine. This is another big issue because medical training is outdated and one size fits all. A lot of doctors learn in school is based on studies done mostly on white men. That means if your symptoms don't match what's in the textbooks, you're more likely to be dismissed. Doesn't that perpetuate systemic racism if I've ever heard it? So an example is heart attacks in women. I'll keep going back to that. Most doctors were taught that heart attacks equals crushing chest pain, left shoulder pain, and shortness of breath, because that's how men experience in them. But in women, it might be nausea or jaw pain. Maybe it's pain boring through to their backs. And because that wasn't part of the standard symptoms, doctors kept missing it. Same thing with conditions like ADHD in adults, endometriosis, chronic illnesses like lupus, and even autism in women. If it doesn't fit the classic case, a lot of doctors just don't recognize it. The next one is that your labs are normal, so you're fine mentality. I gotta say, one of the most infuriating things I hear from patients is when they tell me, my doctor said my blood work is normal, so I guess I'm fine. Let me tell y'all something. Normal lab work does not mean you're fine. There are tons of conditions like early autoimmune diseases, hormonal imbalances, and nerve disorders that won't show up on basic blood tests. But because doctors are trained to treat numbers instead of people, if your tests don't scream disease, they assume nothing's wrong. This is why functional medicine is gaining so much traction, because it actually looks at how you feel, not just what the lab results say. Next thing, and this is probably one of the biggest factors affecting the care that you get at your doctor's appointment. Time constraints and rushed appointments. Let's be real, the healthcare system is a messy, messy bitch. Most doctors get 10 to 15 minutes per patient. That's barely enough time to go over symptoms, let alone dig deeper or establish a rapport with a patient. So instead of investigating, doctors go for the fastest, most convenient answer. And that's how people get slapped with a stress diagnosis instead of getting the real testing that they deserve. So yeah, medical gaslighting isn't just bad doctors. It's a system that rewards quick, easy answers instead of real detective work. And it's the patients who pay the price. But here's the thing, you do not have to accept this. Up next, we're talking about how to advocate for yourself and what to do when a doctor isn't listening. Because let's be real, sometimes you have to fight to get the care that you deserve. All right, now we're getting into the most important part. What the hell do you do when your doctor isn't listening to you? Let's be honest, you can't always just walk out and find a new provider, especially with how hard it is to get appointments these days, the restrictions that insurances place on you. So if you're stuck with a dismissive doctor, here's how to stand your ground, push back, and actually get the care you need. First thing, document everything. Keep a symptom journal with details like when your symptoms started, what makes them better or worse, how they impact your daily life at work. Be specific, guys. Instead of saying, I feel tired all the time, say, I sleep 8 hours, but I still wake up exhausted. I have to take a 90-minute nap every afternoon, and it's caused me to miss 3 days of work. Doctors respond to patterns and data. So the more concrete your information, the harder it is for them to dismiss you. 2, ask direct, specific questions. And this one is key, you guys. Doctors love to move through appointments fast. So you got to slow them down by asking pointed questions that force them to explain their reasoning. Next time that you feel dismissed, hit them with something like, what else could this be? That forces them to think beyond their first assumption. Or you could ask, can you explain why you're ruling that out? This puts the burden on your doctor to justify their decision. Last example, but not least, is there another test or specialist that could help figure this out? This makes it harder for your doctor to shut down your concerns without offering a next step. These questions make it very uncomfortable for a doctor to just brush you off and move on. Third thing I ask you to do is bring backup, a friend, family member, or even your notes that we discussed earlier. Listen, it's harder to dismiss a patient when they've got a witness in the room. As sad as that is, it is true. Bring a family member or friend to help reinforce what you're saying. If you're in a virtual visit, have someone sit next to you or on speakerphone. No one's available? Write down your questions ahead of time and don't leave until you get your answers. Having someone else there or even just a written list can help you focus when a doctor is rushing through the appointment. Last is be firm, but don't be afraid to fire your doctor, guys. I know standing up to a doctor can feel intimidating, but let me remind you of something. You are not being difficult for wanting answers. You are not overreacting because you want to feel better. You are allowed to push back. You are allowed to disagree with your doctor's plan of treatment. If a doctor refuses to take you seriously, it's okay to say, I don't feel like my concerns are being addressed and I need a second opinion. Or, I'd like this documented in my chart that I asked for further testing and it was denied because trust me, no doctor wants to put that in writing. Another one is, I'm not comfortable with how this is being handled. Can we explore other possibilities? And if you're still not getting anywhere, fire them. Find another provider. I know that's easier said than done, but if you have the ability to switch, do it. There are good doctors out there who will listen to you. At the end of the day, your health is your responsibility, not your doctor's, yours. And that means sometimes you have to fight for the care you deserve. Up next, we're wrapping this up. Final thoughts and how you can share your own medical gaslighting experiences. Stay with me. So let's do a quick recap, guys. Medical gaslighting is real. It happens when doctors dismiss, minimize, or outright ignore your symptoms, making you feel like you're overreacting or imagining things. It disproportionately affects women, Black and brown patients, neurodivergent individuals, and people with mental health conditions. So unless you are a white man, chances are you've been affected by this. The consequences are serious. Delayed diagnoses, misdiagnoses, unnecessary suffering, and in the worst cases, death. And most importantly, friends, you are not crazy. Your symptoms are real, and you deserve to be heard. So here's what I want you to take away from this episode. Keep records, document your symptoms, write everything down. Ask direct questions. Make it harder for your doctors to brush you off. Bring backup, a friend, family member, or just a solid list of talking points. And lastly, push for answers. And if you're not getting them, find a doctor who will actually listen. And listen, I know this can feel exhausting. You shouldn't have to fight to be taken seriously, y'all. But until the system changes, advocating for yourself is the best tool you've got. I'd love to hear from y'all. Have you ever experienced medical gaslighting? How did you handle it? What finally got you the care you needed? Send me a message, drop me a comment, or tag me on social media. Because the more we talk about this, the more people realize that they are not alone. And next time on What the Health, we're tackling the weight loss drug boom. Ozempic and Wegovy, you know who I'm talking about. Are they really a miracle cure? Or are we looking at another quick fix with long-term consequences? You're not going to want to miss this. Make sure to subscribe, leave a review if you'd like this episode. Stay safe, stay curious, and I'll see y'all next time. Take care.